Hello everyone, welcome back to the Medicare Space channel. Thank you again for joining in. I greatly appreciate you taking the time to get educated about Medicare and learn about all the things that you need to know. And the question I get a lot from potential customers or people just inquiring that are about to be on Medicare or that are currently on Medicare and just simply have questions. The question I get a lot is, Victoria, do I need an agent? And I guess the short answer would be you don't have to have an agent. You're not required to use an agent. So let me explain what an agent is, first of all. And I explained it when I was introducing myself in one of the last videos. But a Medicare insurance agent is somebody that is licensed through the state that you live in, is appointed through the insurance company that you're about to purchase or that you're about to enroll with, and that is certified, meaning we have to take tests and we have to take certifications to make sure we understand how Medicare works, the knowledge, the plans. So there's a lot that goes into having to become an agent. And the reason why we have to take so many certifications and tests every year is because we need to make sure that the information we're providing you is, the most updated information. Also, the reason why an agent is also good to have, or what we do is we help sit down with you and we help make recommendations. So what an agent should do is they first should always be educating you on how Medicare works. That's the first step. If the agent's not helping get you educated on Medicare, it's probably time to find a new agent. Or maybe if they did, great. If they educated you on everything you need to know, that's a good agent. So the first step is education. We always want to educate the customers on how Medicare works. That's why we know so much about Medicare. So a lot of people get confused thinking that we work directly with Medicare and we're not employed by Medicare. That's not the case. However, we have to know all the rules of Medicare and all the components of Medicare to be able to relay that knowledge to you, right? And then once we educate you, then we also have to help you understand all the different Medicare products out there, meaning the differences between prescription drug coverage, Medicare supplements, Medicare Advantage, and all the companies that are in your area. So as an agent, not every agent, understand that not every single agent is certified and contracted with every company. So when you're working with an agent, it's important to ask them if they work with multiple companies, because if they only work with one, that's really not good, because then that means you're only getting the best plan for that company. You're not necessarily getting the best coverage for you. And that could be with any company that's within your area, depending on your health situation. So when people ask me, Victoria, well, I don't need you get people, I don't need an agent, I do everything on my own. That's perfectly fair. You can do that. There's websites that you can go on, Medicare.gov you can go on. So there's different resources that you can do this on your own. You don't need an agent. But the reason why you want an agent is, one, the great thing to you is we don't cost you anything. So by you using an agent, your insurance prices don't go up, okay? Your benefits do not change. We don't charge you for our service. Our service is technically complimentary unless you enroll. How independent agents get paid, so for example, I'm an independent agent. How independent agents get paid is we are basically self-employed individuals, and we decide which insurance companies we want to work with. The good news about us is that when we're independent and we work with multiple companies, we get paid by the insurance company only if you enroll into a plan. So for example, let's just say I'm meeting with you today, and we meet for an hour, and I go over everything, and I help you choose a plan, and I went above and beyond, and we did everything with you. I helped you, and you felt like you had a lot of help from me. And then you decide, well, you know what, Victoria, you helped me with everything, but I'm going to call my friend down the street because he does Medicare. What? So because we are strictly commission based, okay, if you were to do that, it would be unfair to myself and or your agent that you were working with. It would be unfair for that agent that was working with you to not for you to not enroll with them, because what'll happen is if you go down the street, that other individual is going to get credit, and we did all the work. So just understand that when we help you, our service is free. We're not getting paid by the Medicare heavens above, right? We're not getting paid by the insurance company a salary, and that's independent insurance agents. We only get paid if you enroll. Now, to that, I do want to point out, if you meet with an agent, they're very pushy and they say sign here and sign, you don't know what you're getting. Don't do that. That's not what we're asking you to do. We just want you to understand how the process works. Think of us as almost as a marketing arm. So most insurance companies pay a lot of money to send you mail and to send out commercials and things like this. We are an extension of the companies that we represent. But by having somebody that represents all the companies, we're very neutral. We're not going to steer you one way or the other. Okay. So in essence, to you, the cost to you working with an agent is absolutely free. If somebody's charging you an agency fee, that is against the rules. They cannot do that. So if somebody's asking you for money, and you didn't, anytime you're getting asked for money and you're not actually enrolling into a plan that requires, so for example, Medicare supplements will require a check or your bank routing number, or depending on the plan, if you choose to pay through a bank account, they will ask for that information. But you cannot pay me, Victoria Cabrera. You can't write out a check to Victoria Cabrera for my services. That is completely against the rules. If somebody's doing that, we recommend not to write a check out or give money, and maybe even report that to Medicare, because that's against Medicare rules for us agents to do that. So also, by having an agent, we would be assigned the agent of record. And what that means, if you can't get a hold of the insurance company, or the insurance company that you chose, you're having some type of customer service issue and they're not able to answer your questions over the phone, then call us directly and we can try to escalate that through the company. So think of us as almost your middleman between you and the insurance company. When they can't solve a problem, we can go in there and fight for you. We can go work on your behalf. So with that also being said, if we're not the agent of record, it makes our job a little bit harder, because what happens is when let's just say I'm sitting with you today and you had an issue with XYZ company and you're not a customer yet. If we call XYZ company and you don't want to talk to them and you want me to talk to them for you, unless I am assigned to your file, or I am the agent of record that actually helped you enroll, then I technically can't talk with them. You actually have to talk with them yourself. So there's different benefits on having an agent. I like to be very straightforward. I don't like to hide anything. Yes, we do get paid a commission if you enroll, but keep in mind, we're not getting a salary either. So, by you enrolling is our salary, right? But like I said, don't feel pressure to enroll with somebody if you don't understand what you're getting. If you don't understand Medicare, and if you don't understand all the options and you need more time, that's perfectly okay. That's what we're here for. We're here to wait, and we're here to help you get into something that you're comfortable with. The last thing we want is for you to have a whole bunch of service issues with your plan, and then guess what? We would be the front face of that, and we don't want you to go through that, right? Who wants to go through customer service issues? I don't want you to. So it's always best to do the best as we can in the initial stages when you're enrolling into a plan, no matter what plan you're on. So that way we prevent these things from happening. Will you never have a customer service issue? I highly doubt it. You're always going to have maybe an address change, card didn't come in time, maybe you need to change your doctor, you got this weird letter. There's always going to be things that come up, and that's why it's good to have a go-to resource that you can text, you can call, you can email right away, and we try to get back to you as soon as we can. As much as we want to be at your beck and call, again, if we can get you right away, then that's what member services is for as well. You have multiple streams of communication to help make sure that you're getting the care that you need within your health plan. There are people that say, you know what, I don't need an agent. I like doing everything on my own. I don't need any help. I know how to get on the internet, and I know how to do this, and I know how to do that. And I hate working with agents. I don't like them. That's fine. If that is your preference, then by all means, I would highly recommend to do this on your own. But if you really don't know, you're still kind of stuck and you're overwhelmed, and you really do want that guidance and you want that support going forward in the future, as long as you're on the plan, then an agent is a great person to have on your side. Just like your car insurance agent or your homeowner's insurance agent. It's good to build these relationships with your agent, because when you need something, you can call them, and most likely we'll be able to help you right there and then on the spot, or at least we can guide you on, when you're calling the insurance company, on what to say, how to say it, and these things of this nature. But again, I hope this helped clear things up on if you need an insurance agent. Again, if you have any questions, I'm very straightforward. If you want to call me directly, if you need to email me and you still have questions, I'm happy to help. I hope this clears it up. And if you have an agent now, that is awesome. We're not telling you have to change your agent. We're simply saying we recommend to have one. So if you don't have one, I'll be happy to be here for you. If you're in a state that I'm not licensed in, then I can find you a representative in that area that I work with closely, so that way they can help you too. So again, it doesn't matter what area of the country you're in, I can help you with your questions. So thank you so much for your time. I really appreciate you guys watching this video and all the other videos that I've put out. It really does help out. And if you're finding these things valuable, and you're learning at least one piece of information through these videos, please make sure you pass them on to your friends and family that you think they can use them. You can subscribe. Every time there's a video, a little notification will pop up every time I put out a new video. I will be putting out new videos for a very long time. So hopefully, there's always things that are changing within Medicare. So I don't think these videos will ever stop, to be quite honest. But at least you have a good foundation right now on how these things work. Thank you so much, and have a great day, guys.